all of the witnesses for being here. I want to visit with you, Ms. Maskey, but before I do, I just want to clear one thing up. Professor Bridges, you said several times, you've used a phrase, I want to make sure I understand what you mean by it. You've referred to people with a capacity for pregnancy. Would that be women?
Many women, cis women, have the capacity for pregnancy. Many cis women do not have the capacity for pregnancy. There are also trans men who are capable of pregnancy, as well as non-binary people who are capable of pregnancy.
So this isn't really a women's rights issue.
We can recognize that this impacts women while also recognizing that it impacts other groups. Those things are not mutually exclusive, Senator Hawley.
Oh, so your view is that the core of this right then is about what?
So I want to recognize that your line of questioning is transphobic, and it opens up trans people to violence by not recognizing that.
Wow, you're saying that I'm opening up people to violence by asking whether or not women are the folks who can have pregnancies?
So I want to note that 1 out of 5 transgender persons have attempted suicide. So I think it's important.
Because of my line of questioning? So we can't talk about it?
Because denying that trans people exist and pretending not to know that they exist.
I'm denying that trans people exist by asking you if you're talking about women having pregnancies?
Do you believe that men can get pregnant?
No, I don't think women can get
So you're
pregnant.
denying that trans people exist?
And that leads to violence? Is this how you run your classroom? Are students allowed to question you?
Absolutely.
Or are they also treated like this, where
No,
they're told that they're opening up people to violence?
We have a good time in my class. You should join.
I bet.
You might learn a lot.
Wow, I would learn a lot. I've learned a lot just in this exchange.
Absolutely.
Extraordinary.
Yep.
Ms. Maskey, let me ask you something. So you provide health care to women free of charge, right? Is that right?
Absolutely.
You've done this for many years.
Yep.
You have licensed medical professionals at your pregnancy care centers. Is that right?
That is correct.
What are some of the resources that you provide for women who come to you in a time of need? Just give us you talked about it in your written testimony, but just give us a sense of it.
So we have 3 OBGYN doctors, 5 registered nurses, nurse practitioners, physician assistants, phlebotomists, medical assistants, and we provide prenatal care, OBGYN care. We provide pregnancy tests, ultrasounds, well woman visits, breast exams. We provide a wide range of medical services. Yes.
So what do you think about the DC politicians now saying that your clinic and the other 3,000 pregnancy care centers around this country are fake medical clinics? For instance, Senator Warren has said it's now more important than ever to crack down on so-called crisis pregnancy centers that mislead and deceive patients. Senator Menendez, crisis pregnancy centers jeopardize women's health and well-being, all while elevating unproven theories about birth control. Senator Warner wrote to Google asking them to censor search results for care centers like yours,